Welcome to 9th NEET-PG 2024 recall question. So before seeing this video, please subscribe my channel. So a patient 20-year-old female G5L4 with all four girl child. So living his number is 4. Previously all four girl child present at 18 weeks asks for sex of the child during ultrasound. This is our first antenatal visit. So what should be done according to PCPNDT Act? So do the USG for gestational age, anomaly scan or any detection of any maldevelopment, check sex and tell the mother? Obviously no. This is against the PCPNDT Act. Okay, so obviously not. Next is do USG for gestational age, anomaly scan, check sex and don't tell the mother whether. Obviously do not tell the mother. Is it okay? It's okay, but whether to check sex, yes or no, we'll come to this point later on. Do the USG for gestational age, anomaly scan, don't check the sex. So still the question whether the option is B or C, or don't do the USG, do A and C only. This option is also wrong. So A and D is wrong. Two option is remaining. This radiologist is checking the anomaly scan as various sex like male or female is associated with different type of congenital anomalies. So it is very usual that radiologist will check the sex whether it is male or female, but he or she should not tell the mother what is the sex status of the child. So definitely the radiologist will check. So the answer is do USG for gestational age and anomaly scan, check the sex but do not tell the mother. It is against the law. So this is the answer. So this is also wrong. So don't check the sex is also wrong. So the option is do ultrasonography for gestational age, for anomaly scan or for maldevelopment, check sex and do not tell the mother. 82 patient presents with this finding. Probably this type of eye picture was given. This is nothing but prominent KF ring, Kaiser flexure ring, suggestive of, yes, very good, this is Wilson disease. So Wilson disease, they ask best investigation. As you know, all this investigation is required for diagnosis of Wilson disease. In Wilson, serum ceruloplasmin low, urine copper, hepatic copper, MRI brain, where you can find the panda sign. So basically everything is needed, but the best investigation is always estimation of dry copper, okay, in the liver parenchyma. So dry weight of copper in the liver parenchyma is always the best investigation, and this serum ceruloplasmin is usually done for screening. So this is not best investigation. Okay, so the answer will be hepatic copper estimation will be best investigations for Wilson disease, and the cutoff was I think more than 250. Okay, gravida 2 with previous cesarean section again underwent cesarean delivery, but during delivery there was torrential bleeding and hysterectomy had to be done by the surgeon. So image of the uterus shown. Obviously this is not placenta previa. This image, this is also not abruptio placenta, abruption is not visible. This is not also ruptured uterus, but see the placenta is actually invading inside the myometrium. So this is nothing but placenta accreta spectrum. Okay, so placenta accreta, so this is placenta accreta spectrum. Okay, next coming to question number 84. Patient on examination there was periorbital or knuckle hyperpigmentation and patient was hypotensive, potassium was high, heart rate was normal. So what is the diagnosis? So hypotension and hyperkalemia. Basically this hypotension, hypokalemia along with this knuckle hyperpigmentation suggestive of primary Addison disease, or also known as primary Addison disease or primary adrenocortical insufficiency, where there is less hormone synthesis, mineralocorticoid, glucocorticoid, okay, by the gland. So cortisol will be low, but ACTH will be high because of loss of feedback mechanism, and this ACTH will cause hyperpigmentation. So as primary Addison disease cortisol low, by negative feedback mechanism ACTH increases, this causes hyperpigmentation. So the defect in is the adrenal gland. This is not secondary Addison, this is primary Addison disease. Okay. Question number 85. Patient shown with image, these two image A and image B, and image C was visualized. Okay, so after test being done with these two things, patient can see the image C, means this image is perceived by the patient. So what is the likely diagnosis? So this is ORTH4 dot test. It is done for status of peripheral bino-ocular cooperation. In normally there is 4 light, so this is normal. Okay, if there is left eye suppression, patient can sees only 2 lights, red color, and if there is right eye suppression, patient sees 3 green color light and 5 lights if there is diplopia. This is uncrossed diplopia and this is crossed diplopia. Okay, in this image patient is seeing 3 green color dots. See here, 3 green color dot. So this is nothing but right eye suppression. So 3 lights, right eye suppression. So the answer is right eye suppression. I think it's very clear to you. This is the interpretation of ORTH4 dot test. 86. False statement about Graves' disease. No specs classification used for this condition. Yes, it is true. So this is not false. 10% cases occur without systemic hyperthyroidism. It is also true, because there can be 90% cases in Graves' ophthalmopathy with hyperthyroidism. There can be 6% euthyroidism. 4% case can be hypothyroidism. So 6 plus 4, 10% without any systemic hyperthyroidism. True. Several cases finally leads to vision loss. It is also true. Optic nerve compression because of Graves or vitopathy, secondary optic atrophy can cause vision loss. So all these 3 statements are true. So the question was about false statement. It is response to treatment is proportional to findings. No, it is not always proportional. Whatever the eye findings, the response to treatment may not be proportional. Coming to question number 87, patient with ectopia lentis. I think this was clinical scenario based question. I don't remember actually what was the actual question in scenario that was discussed, but whatever I have heard from my juniors, it was a case of homocystinuria, and the question asked which vitamin to be supplemented in this case. Obviously it is vitamin B6. So vitamin B6 and cysteine is supplemented in patient of homocystinuria. So the answer is vitamin B6. The question number 88, 2-week-old boy presented with recurrent vomiting, early cataract and organomegaly. So what is the diagnosis? Yes, this diagnosis is galactosemia. So galactosemia, when this galactosemic infant given milk, the unmetabolized milk sugar build up because of some enzyme deficiency, and this enzyme is galactose 1 phosphate uridyl transferase. So very big name, galactose 1 phosphate uridyl transferase enzyme deficiency, and this unmetabolized milk build up and damages the various organ like brain damage, like early cataract. It can cause jaundice, it can cause enlarged liver or organomegaly or hepatomegaly. It can also damage kidney. So these are the features of galactosemia due to galactose 1 phosphate uridyl transferase, usually seen after initiation of breast milk feeding. Next, coming to question number 89. 14-year-old boy, recurrent episode of bleeding from nose, nasal endoscopy shown. So this is clear picture of JNA, juvenile nasal angiofibroma. Age was also 14 years and there was typical history of recurrent bleeding from nose or recurrent epistaxis, and the investigation of choice will be, yes, it is CT contrast. So contrast CT scan, computed tomography. Question number 90, identify the mark structure in the cochlear implant. Here one free cord-like structure is asked. See the structures of cochlear implant. This is actually microphone with battery and speech processor placed just behind the auricle. So microphone with battery and speech processor. This is external transmitter. This is implanted receiver or stimulator, and from this one free cord-like structure is coming, that is reference electrode. Another electrode is going to the intracochlear region. This is intracochlear. So two freely hang cord-like structure going towards the cochlea. This is free. This is one electrode, this is another. So this is basically nothing but reference electrode. So this is electrode. I think this electrode was marked, and the question asked what is the mark structure. This is electrode. In the next segment I am going to discuss question number 91 to 100. So kindly subscribe the channel for more videos. Thank you.